my name is Kendra Primavera. I am a physician assistant here at Florida Spine Associates. I think I like helping people. I think I love anatomy and physiology, and I've always been interested in orthopedics after my own ACL injury during soccer in high school and going through surgery at a young age. It just kind of drew me into that field. In college, I kind of explored different professions in the medical world, and I met a bunch of physician assistants. I didn't even know what the profession was at the time, but shadowing them in a bunch of hospitals during college, I really grew to respect the profession. Working alongside different providers in a team environment, being able to prescribe medications, treat, diagnose, do almost everything a doctor can do with a little bit less schooling, it attracted me to the profession right away. My first job as a PA was over in San Diego. I worked in a pain management practice. I was treating different orthopedic injuries and ailments, especially spine, and I fell in love with spine and ortho, and that's what kind of led me to taking this job at Florida Spine Associates. I knew I needed to move back to the East Coast to be closer to family because I'm from the Boston suburbs and my parents are snowbirds, so they come down here to Naples, Florida. So I wanted to get closer to family. We wanted to stay somewhere warm, and I found the perfect area down here in Boca and Delray is where I live. So I took this job at Florida Spine Associates to be a little bit closer to family and still do what I love to do, working in ortho spine. I'm easygoing enough, where I don't get mad at little things. I respond to stress very well. I adapt well. I work well with the team and our staff and our medical assistants. We're all very close. We're pretty much friends. And then especially me and Dr. Norton, I think we work very well together. We have very similar personalities and we mesh well, and I think that is also something that made me excited for this job. Is he's a great mentor and colleague. I just got married this year, and my husband definitely very supportive of my career. He definitely sees that compared to my job as a PA, and now I am really growing, and this is really pushing me in the spine world, in the orthopedic world, and he's very happy for me. I come home and I tell him all about my patients and my day. Sometimes he sees how exhausted I am and he cooks for me, and he knows that this is a tough population to work with, and I bring home a lot of my emotions, and he kind of lets me just talk it out with him, and he's been very supportive. My personal motto when it comes to medicine is to be there for the patient. I want to be able to listen to them, understand them. As I said earlier, the spine world and the patient population is very tough. Most of our patients are coming in with chronic pain, and you have to be able to be there for them. Sometimes they need to come in urgently for an appointment and get some medication refills or get some new x-rays, or just, they want to come in and discuss the symptoms they're having. I like to make sure that I can squeeze them in at any time and be there for them, because I know what they're going through is really tough. So for me, most of the time that I spend with my patients is going to be going over preoperative and postoperative appointment care. So I see the patients before they even have surgery. That's our pre-op visit. Dr. Norton has already gone over their MRI findings with them and is now recommending surgery. So for that preoperative visit with me, that's really important. I spend a good 30-45 minutes talking to this patient, explaining a little bit more in details what the surgery is going to entail. We go over the timeline of recovery. We go over the expectations. We go over bracing and physical therapy afterwards, visiting home care, all these things that they're going to need for their recovery, and activity restrictions, things that ensure their healing is going to occur properly. And so it takes up a lot of time, and I really sit there and I answer all of their questions, and I make sure that before they leave that room that they're comfortable going through this surgery. So So that visit definitely takes up a lot of time. And then afterwards, after surgery, they come back and see me and Dr. Norton, and we do their post-operative visits. And this is every few weeks. We're having them come in, we're doing x-rays, we're going over their results, we're asking them how they're doing, we're looking at their incisions, we're making sure that physical therapy is going well, and again, we're sitting there and answering all their questions and concerns. So we do spend a lot of time in the room with the patient and making sure they're comfortable. It's so important to spend a lot of time with our patients because they're going through a lot. The surgeries that they're going through require a lot of attention in their post-operative care. So we want to make sure that we spend that time with them, making sure that we answer all their questions and concerns and that they're healing properly. What really stood out to me about Florida Spine Associates when I came for the first time and I met everyone was the positive energy everyone kind of gave off and the sense of teamwork. I think it's very unique to have different providers and specialties. You know, they have pain management here, surgery, physical therapy, and all of these providers can be treating one patient at the same time. And I found that very unique and special about Florida Spine Associates. My last job in San Diego was great. It was my first PA job, but I think starting here, I've really grown, and the doctors here really push me to be better and treat the patients, you know, with empathy and understanding. It's a very tough profession working in the spine world in general, but I'm more on the surgery side of things, whereas before I was in pain management. I think now doing the preoperative, postoperative care in surgery, you really have to be in tune with the patient's feelings and symptoms and emotions. It's a very, very tough field, and it's really helped me grow in this specialty. I saw you out in public and we're hanging out and you started complaining about your neck and pain and stuff. I'd probably right away be like, you gotta come see us. You know, it doesn't mean you're gonna need surgery right away, you know, don't be afraid, but it's always good to be proactive about your neck and your back and your spine. It's something that usually can be degenerative and we don't want, you know, things to get worse. We like to kind of slow down changes in the spine, and usually if you come see us, we can get some baseline x-rays, we can kind of go over what we're seeing in your neck, and we can kind of set up a good plan to kind of stabilize, control your symptoms, keep your neck strong with some physical therapy, and hopefully, you know, restore your quality of life so that you won't need surgery. Working with Dr. Norton has been a great experience so far. Like I was saying, he and I get along very well. He's a great mentor. I've learned a lot from him. He is great with the patients and they really do respect him. He's highly regarded in this area as a surgeon, and it really does show. It's very interesting because I would say most of our patients are coming in because of their friends having had surgery with him. They refer their friends to us and they say, hey, you know Richard, you know Bob, he sent me here. He told me nothing but great things about the surgery with Dr. Norton, and that's all we hear, and it's just all positive things about him. So it's an honor. It's been an honor working for him. And then especially me and Dr. Norton, I think we work very well together. We have very similar personalities and we mesh well, and I think that is also something that made me excited for this job. Is he's a great mentor and colleague. So I think he would also say I'm pretty easygoing and kind. Sometimes if Dr. Norton gets done before 5, which is very, very rare, we take a picture together with his phone up that says 5 o'clock on it because it's just never done. You know, he sees so many patients in one day, so it's rare that we get out on time, but we don't complain, you know. Our schedules usually run a little bit late and our patients know that too. I think that's another funny thing is a lot of our patients, I think the only complaint they have about our office sometimes is the wait time and out in the lobby. But, you know, as soon as they come in and they talk to us and we spend the time with them, they kind of understand, you know, why we're running behind towards the end of the day. But I think it's funny because he likes to take that picture with us if we make it before 5. Now that I've been at Florida Spine Associates for about a year, I do have some goals over the next few years. Right now, I'm Dr. Norton's clinic physician assistant, but he's talked to me about training me in the OR. He does have an OR physician assistant, Dan, right now, and I've shadowed them in the OR, and I'm learning a lot. In PA school, I did do a rotation in surgery for over 5 weeks, and I loved that. So I'm hoping in the next few years that I can get some OR experience as well.